Australia's Northern Territory will keep its borders closed to visitors from COVID-19 hotspot states until 2022. Also, the death rate among aged care facilities in Australia is among the highest in the world. Joining us tonight is one of our correspondents in Australia, Marvy Delfin, to tell us why. Live. Marvy?
Yes, until today, the Northern Territory has only 34 confirmed cases of coronavirus infection, and 32 of those patients have already recovered. There are no death cases due to COVID-19 in the territory. Now, the Northern Territory government has decided to extend its border closure for at least 18 more months, while its closure for Victoria will remain indefinite. Chief Minister Michael Gunner said the decision to maintain hard borders was made to protect the territory's vulnerable remote indigenous population. He also said the territory has been recruiting extra police to keep hard border controls in place. More health staff are also hired to help with screening at airports. Anyone coming from Sydney or Victoria will have to complete 2 weeks of quarantine at their own expense if they want to enter the territory, while Northern Territory's residents are encouraged to stay within the territory for their safety amid the pandemic. Meanwhile, the tragedy unfolding in aged care homes in Australia has prompted the Royal Commission into Aged Care Quality and Care to examine the response to COVID-19 in the embattled industry in a 3-day hearing in Sydney, which started this Monday. As Australia grapples with its aging population and the COVID-19 crisis, the country has witnessed aged care residents accounting for the 203 out of the nation's COVID-19 death toll of 290. That is approximately 68%, making Australia one of the highest aged care COVID-19 death rates in the world. The aged care sector is also bracing a record yearly drop in occupancy levels as it reels from the impact of the pandemic. The declining rates of occupancy has flagged concerns for the aged care sector's ability to recover after the COVID-19 crisis. Australian families, aged care residents, and workers now fear that there may be no hope of fighting COVID-19 and protecting the residents in the nursing homes if the various levels of governments are not effectively collaborating and planning enough to decide who would call the shots in the event of an outbreak. Kath?
Marvy, with the present situation in aged care homes, are families still advised to send their elderly relatives to those facilities?
Kath, despite the raised issues, the government still urges that in many cases, aged care homes was still the safest place for older Australians to be, and encourages families to consult any prospective facilities about their COVID-19 planning and safety measures, like screening procedures and nurse-to-patient ratios. Kath?
Marvy, if the border closure is for 18 more months, what about the holidays? How would Territorians spend their holidays?
Well, Chief Minister Gunner advises Territorians that if they could, they should cancel their December holiday plans and stay, because for Gunner, it's Territorians first. Actually, the border announcement comes just 1 day after Prime Minister Scott Morrison said that he was against the odds, hopeful that there would be a relaxation of some restrictions by the coming holiday season. But Gunner said he thinks it's unlikely that we are able to move back to a restriction-free society, and added that he doubts that is going to happen. Kath?
All right, Marvy, thank you for that report and stay safe in Australia.